Hello, my name is Mikael Nordfors, and I want to tell you about the Independent Medicine Foundation. How to improve health and diminish the need for expensive medical interventions for the population of Africa and also the rest of the world, of course. Well, the foundation will use an information portal for public evaluation of medical research and case stories, and that's already available on the website www.medicdebate.org, where everyone can participate. In this website, you can put in all new research papers, and they can be discussed and rated by everyone. And then you can find a list of the most interesting research items in a special subject or during a special time period. We'll also try to make available cheap and safe health-enhancing treatments to the African population by arranging trainings in cooperation with major private and public institutions like churches, NGOs, and governments. We'll also create a distribution network for this knowledge and associated substances. Well, how is it today with conventional medicine? To a large degree, unfortunately, I have discovered very painfully through my medical career that if you try to heal people, you might end up in trouble, because the medicine is very much based on the capital interest, not on patient needs. And if you cure too many people with a cheap and effective method that is not patentable, you are not a very good friend of the medical system. You can really have problems. So how is it today with conventional medicine? Well, a cheap side effect-free treatment have virtually no chance of getting accepted. And if the cure is not patentable, there is no money for medical industry research and limited access to university clinics. If you anyway manage to make a study, there is problems to get it published, as most medical newspapers are sponsored by ads from the medical companies. If it will be published, it might not be able to get the proper attention. Probably no one will read it. And there is no money for advertisement marketing compared to the massive amounts available for the medical companies. It would most probably be actively combated by the medical companies and the authorities, who are most often representing the same capital interest. And most doctors are very scared of doing something that is not part of the official recommendations. They might end up in trouble and lose their license. So we have a medical system that is not for the people, but for the capital interest, and there are lots of evidence for this. So I created a website called www.medicdebate.org, where we try to replace propaganda with critical thinking and debate. And that's a website where all medical information can be evaluated and debated by everyone. That means that you can give a rating to everything that's put in, and you can also debate everything. You can have different opinions, and you can see which one has the strongest value. All contributions, research, papers, reports will be evaluated and debated, as you see. The result of this will be that all interesting new discoveries will be immediately made available to the public without bias from propaganda and advertisements. Here are some examples of promising treatment methods. For example, tendon attachment therapy. By pressing certain points on the body, you can relieve 80-90% of all musculoskeletal pain conditions, thereby reducing the need for painkillers and orthopedic surgery. Everyone can learn how to do the basics in 3 days if you have some compassion and strong hands. No side effects except occasional bruises. Just yesterday I had a friend of mine who couldn't go up from the bed because of back pain. He had to pee in the little bucket beside, and now he's fine. It took half an hour. And I did that thousands of times, and many other therapists in Germany too. Chlorine dioxide. A dark, cheap substance that can clear contaminated water from parasites, viruses and bacteria, thereby reducing the risk of getting cholera, typhus and other gastrointestinal infections from contaminated water. If you give 1 milliliter of it, this is done. If you give 10 milliliter, it also has shown to relieve the symptoms of COVID, AIDS and malaria. Iboga root bark is another example, a traditional African herb that have been shown to diminish the cravings for drugs like heroin, alcohol, nicotine and cocaine. It also has a positive impact on soul balance and mood, diminishing anxiety and depression, increasing cognitive abilities and religious connection. It has to be handled with some care when used in higher doses than you have to be used together with an expert, but otherwise it's safe in low dose. Surinum 6X is a homeopathic preparation with excellent effects on cancer, proven by many studies in India without serious side effects. These studies have been scrutinized and published by the NHA in USA. There are water cleaning and enhancement of water quality with so-called Kangen machines and similar products. So access to free water in Africa, for example, here in Arusha, there is a big problem with fluoride in the water that is having detrimental health effects on many people. And of course, diet training. Many Africans doesn't eat very healthy food. They eat too much sugar and empty carbohydrates like French fries, creating metabolic syndrome, diabetes and obesity. So how to start this project? We make education programs teaching people how to become more healthy with simple, safe and affordable methods. We create education material available through our website as PDF and books. We will always be on the search for new and better methods through our website www.medicdebate.org, where everyone can contribute and evaluate new material. We collect money through selling products, contributions from churches, NGOs, private and public entities and participants. We will also create a distribution production network for pharmacies, food shops and a web shop. And here are some links that you can use. I will put them also in the description of the video so you can copy them directly. Thank you very much for me, and you are welcome to participate in this project.